Hi guys, welcome back to HMS. It's good to have you back. I'm Tosin and welcome back to our channel. So today we'll be talking about writing clinical exams in medical school, particularly clinical school. So if you're a clinical student, you know that this is like our way of life. Exams, and of course, they take pride in the fact that you have to write a clinical exam. So we'll be dividing it into 3 parts: before the exam, pre-exam, during the exam, and after the exam, post-exam. So now, the first thing here is that you should practice all the necessary examinations that you will need to do in the exam. Now, it's not just enough that you've been doing these things over and over and over. Of course, that is important. You should have been practicing how to do your general physical examination, cardiovascular examination, respiratory examination, abdominal examination, neurological examination, musculoskeletal examination. You should have practiced all of that like regularly during the posting. But it is also pertinent that some days before your exams, you practice these things again. And the whole point of practicing them again is just so that you refresh your memory as to what is going to be for you in exam. Because doing it on a normal day is different from doing it in exam. So the way you want to go and do it when your consultant is there is what we're talking about now. So practice it. If you can get a friend you can practice it on, and then your friend practices on you also, that will be perfect. But if not, you can do it with your pillow. We do that a lot, particularly with obstetric examination. That's like the order of the day. So practice all the necessary examinations before you go for the exam. And then the second tip here is that you practice all the common cases and then the common symptoms. Of course, during your posting, you should have gotten familiar with the cases on the ward. You should have gotten familiar with the cases you saw during the posting and how to clerk them, such that when you are asked, when your patient presents with, say, a symptom like, say, cough, you know 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 things you want to ask your patient without trying to remember and wasting time. So practice. And particularly for Osce, you need to be very, very good and time conscious with clerking common symptoms and cases, because Osce stations are timed. You either have 3 minutes or 5 minutes in each station, and you have to ask all the necessary questions within that time frame, because that's what your examiner is going to mark you on. So all these things are all about practice and getting familiar with them. And it will not only help you with your Osce, it will also help you with the long case exams that you have to write, because it makes you to be time conscious, and within few minutes you're good to go. So the third thing for the pre-exam preparation is that you get all the things that you need for your exams ready, which we discussed in the last exam. Get your stethoscope ready, your patella hammer, your tape measure, your word coat, your matric number tag, your tuning fork, diagnostic set, all the things that you will need for the clinical exam. Let them be ready. Don't get them ready on the morning of the exam, no. Because of course tension is flying everywhere. So get them ready like a week before. Let them just be breathing somewhere. So the first thing is that you should rest well a night to the exam. If you've been diligent with preparation all the while, the night to the exam is not when you will now want to overstretch yourself again, because the tension of clinical exam is enough to make everything fly away. So if you now couple it with the fact that you are not well rested and your brain is not settled, that's an accident going somewhere to happen. So please rest very well, because I'm sure that by the time you even cite your consultant or your examiner, tension practically multiplies by 100-fold. So please get good rest a night before your exam. And of course, coupled with that is that you should take breakfast before going for your exam. Don't go there with an empty stomach. No, please. Let your brain have at least some level of glucose, because that place is usually hot, if you know what I mean. So please go there with enough energy, with enough glucose in your body, so that you can withstand the darts of the fiery ones. And of course, the last thing but not the least under the pre-exam preparation is that you should arrive the hospital early. You don't want anything that is going to destabilize you the morning of your exam. So get to the hospital, wherever you'll be writing your exams, as early as possible, so that you're well settled way before the exam even starts. So let's go on to the during the exam tips now. So the first thing is that after you've been allocated a patient, greet your patient, introduce yourself, build rapport with the patient, and of course you should explain what you're about to do with the patient, so that you have the patient on your side. For many of my friends that told me about their clinical exam experiences, it was even the patient that was advocating for them with the examiner that, oh, she actually did this, oh, she actually checked. You know, imagine that you got there and you just started asking questions without building rapport with your patient, or at least making friends with your patient. That would be so bad and disastrous. So please explain what you're about to do with the patient. Be friendly with the patient, because you really don't know. Your passing the exam might be heavily dependent on that patient. So build good relationship with that patient, at least for that time period. Then the next thing you should do is to be time conscious. Be time conscious always in the clinical exam, particularly long case and even Osce. Long case in my school, they give you 45 minutes to clerk, then they question you for 15 minutes and 1 hour you're done. So imagine that you didn't do all the things you're supposed to do during that 45 minutes. Wahala. So please make sure that you're time conscious. You should finish your clerking within 30 minutes, do the necessary examinations, and that takes me to the next point. Make sure you do all the necessary examinations during that allocated time. Some of our examiners, what puts them off is when they ask you, report the respiratory examination, and the next thing they hear is, sorry sir, I didn't do it. It triggers them, puts them off, and just become unnecessarily irritable. So please, try as much as possible. You might not have done it in detail during that 45 minutes, but at least do it. And of course, the very important trick in this part of the exam is that once you finish clerking and summarizing, and you've done the general physical examination, you've done your vitals, the next important system to examine is the affected system. Do that affected system, then when you're done, you can now go ahead to do the other part of the examination. So that will be very, very important. And also, I would like that you also note that you should document as you clerk. Don't say that when I finish clerking, I'll now come and document. No, as you're clerking, be documenting, because the examiners are just by the corner waiting for you to finish for 45 minutes to end so that they can examine you. So be very, very time conscious, document as you clerk, do all the examination. And of course, one of the other important things is that you should present your case confidently. The things you've done, present it well. I mean, let them know that you actually did this thing, that you understand the reason why you are doing it. And because most of them will ask you, why did you do this? Why did you ask this? What were you trying to rule out when you asked this question? They're going to ask you questions. So be sure about the things you're doing and present your case confidently. So those are the important things you need to take note of during the exam. And of course, post-exam now, which is the last part of this video, is that when you are done, go and rest, go and sleep. The battle is of the Lord. It's medical school, things are really crazy here. So just go and rest your brain, go and eat good food, treat yourself to a nice meal, and leave the rest to God, because last now will God help go pass. Okay, so thank you so much for tuning in today. Thank you for watching our video. I hope you learned 1 or 2 things, and hopefully these things, you'll find them useful in your next clinical exam and every other exams that you have to write. So if you found this useful, please kindly share with your friends in other medical schools, students in your schools, every medical student you know. Please share with them so that they can also learn 1 or 2 things from this video. And if you found it useful, also make sure that you like this video, comment, and also subscribe to our channel, because we have more amazing content coming your way. So till next time, see you. Bye.